Volcano sign. It is descriptive term for the morphologic feature of Old World cutaneous leishmaniasis. The lesion starts as small non-tender papullae, which enlarges in size and ulcerates in the center. The border of the crusted ulcer often has erythematous rim. MEFFERT'S sign. It is described in Fordyce disease, characterized by presence of ectopically located sebaceous glands on the lips, oral mucosa, and less commonly on gums. Prominent lip involvement can result in a lipstick-like mark left on the rim of a glass mug after consuming a hot beverage. Raccoon sign. The common cutaneous manifestation of neonatal lupus erythematosus is erythematous, slightly scaly eruption on the face and periorbital skin. Periorbital hemorrhage due to laxity of blood vessels seen after proctoscopic examination. Post-proctoscopic periorbital purpura in patients having systemic amyloidosis. Antenna sign. It is seen in keratosis pilaris. Some follicles are completely spared while adjacent one are grossly plugged, showing a long strand of keratin protruding. When examined in tangentially incident light, GOTTRON'S sign. It is a characteristic finding in dermatomyositis, characterized by scaly erythematous eruption. Seen on the dorsa of hands, metacarpophalangeal joints, and proximal interphalangeal joints. SHAWL sign. Confluent macular violaceous erythema on the posterior neck, upper back, and shoulder in patients of dermatomyositis. Sandwich sign. In dermatophytosis, fungi are present in the horny layer between two zones of cornified cells, the upper being orthokeratotic and lower consisting parakeratotic cells. Summit's sign. Dystrophic and ragged cuticle seen in dermatomyositis. Wrist sign, also known as Walker's sign. The distal phalange of the first and fifth fingers of the hand overlaps when wrapped around the opposite wrist, seen in patients having Marfan syndrome. Thumb sign. Steinberg sign. In patients of Marfan syndrome, the thumbs protrude from the clenched fist beyond the ulnar border of hand. Hairy palm sign. It is a characteristic histopathological finding seen in prurigo nodularis. There is a presence of thick compact orthohyperkeratosis. The hairy palm sign. Folliculosebaceous units seen with a thick and compact cornified layer. Seems like that biopsy has been taken from palm, but contains pilosebaceous unit. Foschimmer's sign, seen in 20% of rubella patients. There is an exanthem of dull red macules or petechiae confined to the soft pala during the prodromal period or in the first day of the rash. Can also be seen in infectious mononucleosis. Love's sign. Exact localization of tenderness with the help of pinhead in glomus tumor. Leser sign, first described by Edmund Leser and Ulysse Trelat, characterized by sudden eruption, of numerous seborrheic keratosis usually associated with pruritus and is considered as a marker of internal malignancy. Winterbottom's sign. It is seen in early stages of African trypanosomiasis caused by Trypanosoma brucei rhodesiensis and Trypanosoma brucei gambiensis. It is enlargement of lymph nodes in the posterior cervical chain. Breakfast, lunch, and dinner sign. The bites of bed bugs, Cymix lectularius, usually follow a linear pathway in a group of 3 to 5 blood meals and are often referred to as breakfast, lunch, and dinner, or breakfast, lunch, and supper sign. Gorlin's sign. It is the ability of patients of Ehlers-Danlos syndrome to touch the tip of the nose with the tip of their tongue. Friar Tuck sign. Friar Tuck was a companion of Robin Hood in the legendary stories who had alopecia of the vertex with sparing of occipital region. This is described in relation to trichotillomania, where patient plucks his own hair either in a wave-like pattern across the scalp or centrifugally from a single starting point. Hairs over the occipital area mostly spared in trichotillomania. Holster sign of dermatomyositis. Literally, holster means an extra pocket made from various materials to hold something where it can quickly be taken out for use. Gun holster. Confluent macular violaceous erythema present on the lateral side of hip and thighs called as holster sign corresponding to the site of hanging a holster. Albright's dimple sign. This is seen in Albright's hereditary osteodystrophy. There is presence of a dimple over the knuckle of the typically affected fourth metacarpal and can be enhanced by clenching of the fist, seen in young women with short stature and disproportionate shortening of limbs. Hanging curtain sign. It is seen in patients with pityriasis rosea, when the skin is stretched across the long axis of the herald patch. The scale is noted to be finer, lighter, and attached at one end, which tends to fold across the line of stretch. Thanks for watching. Please do like, share, and subscribe.